So hi everyone out there on this sunny Thursday in the United Kingdom. I'm going to be going live to Florida today. We haven't been to Florida in our world extravaganza and our travels. We've been to Australia, we've been to New York, we've been to Philadelphia, we've been everywhere in England, but we haven't been to Florida yet. So we're going to be talking to a plastic surgeon in Florida, David J. Levens. Now David runs a practice just south of Fort Lauderdale. He does a number of procedures. His main focus is breast surgery, and David's going to be talking us a little bit how his practice runs. His practice has grown and grown and grown, and is very successful. He's going to be talking to us about breast surgery, practice building, and what it's like to live in Florida. So hi David, how are you?
Hi, good morning or good afternoon for you over there in London.
Yeah, so how have you been?
We've been managing. We've been doing okay. Kind of shut down for about 7 weeks, but just slowly clamoring and getting back. And we're actually going to start seeing patients live this Monday. We got the go-ahead from the state of Florida to start with elective surgeries last week, and I was able to do one actually yesterday, which was great. So, and we've been doing virtual consults pretty much like everyone else.
Yeah. And what was your first operation when you came back, David?
Well, this is interesting because it was a kind of a big procedure at the hospital. It was a massive weight loss patient. I did a brachioplasty or arm lift, and she had already had a breast reduction in the past, got quite a bit droopier. So we did a mastopexy and some auto augmentation with kind of some flaps. I had not done her first surgery. It was about 14 years ago. I did have some concerns about the circulation and everything, but I got through it, and I think everything looks good. And her nipples were nice and pink and viable at the end, so everything went well.
Well, you started off with a big operation. So for people out there, could you talk a little bit about weight loss surgery? So what is a brachioplasty, David?
Sure, no, absolutely. A massive weight loss is usually someone's lost 50 or 100 pounds, typically from a bariatric surgery where part of the stomach is closed off so that they can't eat as much, and so they're forced to lose the weight. Some people lose it on their own. And then usually after at least a year and the weight is stabilized and they're a candidate for doing various things. And it starts from the head to the toe. So it can be the neck, it can be the arms, it can be the breast, the abdomen, the thighs that become loose and saggy, and the skin is just very loose. So a brachioplasty is a so-called arm lift surgery, which cuts away the skin, the bat wings or the loose skin underneath the arms. And that's with the brachioplasty. And then with the breasts, she had a lot of droopiness, but she still had some pretty good fullness. So right away she thought about implants, and I said, we probably can use your own tissue to try to create some fullness without having to add the complexity of an implant. So it went very well. They did a COVID test. That's the hospital protocol at this point. I mean, so people want to know, are we going to be testing everyone? Are we not testing? I'm not sure what it's like in Europe and the UK, but the testing issue is a problem here, and the validity of the test, the predictive value, whatnot. So the hospital district where I did the surgery decided that they would do a COVID test on everyone. It was like about a 5 or 6 hour antigen test, and she came back negative, and of course we proceeded. Had she been positive for purely elective surgery, I probably would have said it doesn't make sense to do this. It's elective cosmetic, as opposed to, I spoke to a couple of my surgeon friends that, they have patients with a appendectomy and whatnot, a broken hip, that you have to proceed anyway with proper precautions. So
yeah, absolutely. Well, I'm glad she's doing really well. So
far so good.
Did her arms? Are you doing anything for her abdomen?
Well, that's hopefully later. I mean, I do have a few colleagues here and there, and I'm sure you've heard about them. There's a Dr. Hurwitz in Pittsburgh who is the total body lift doctor. I don't know if he's still doing them, but he would spend the entire day with multiple surgeons doing an entire body. But for me, it's exhausting for me, for the patient, I think risky. So typically what I do is I say, like, what's your biggest area of concern? And so it was her arms and breast. So if we can get a good result with that, then 6 months or a year later, we can tackle her abdomen. That would be what we'd be looking forward to.
Yeah. Well, yeah, brilliant. So you've got quite a broad range of interests, haven't you? So from facelift surgery to breast surgery, tummy surgery.
Yes.
And what is there anything particular that people in Florida, that is more popular in Florida?
Well, I think definitely there's a lot of sun exposure here, and so people have to be concerned about the sun, and there's a lot of skin cancer. In fact, I did take care of a melanoma patient. I was, for 6, 7 weeks just trying to stay on social media, do virtual consults, whatnot, and but we were allowed to do quote unquote urgent, and this was a patient with melanoma, so I was very excited to get back to the hospital. I'm sure that the patient was excited to have it done, but so skin cancer is definitely big here in Florida, and then as far as things like, breast implant sizes and things like that, it's funny, I've been here for 30 years and, patients, every week, once a week or twice a week, will say, well, everyone has breast implants. And I say, no, not everyone has breast implants. It's just that you're more exposed. It looks like they do. It's not a requirement to live in Florida. But breast augmentation is pretty popular here, yeah, for sure.
Yeah. And what's the trend? What's the trend for breast augmentation in?
I definitely think that it's. I've been following your IG lives, and I think it's similar all over the world. Actually, that the trend is a little bit smaller and not necessarily as large anymore, and definitely possibly using fat as an alternative, auto augmentation, or supplementing an implant with fat. I think that we're more aware of the long-term consequences of large implants. There've always been patients that insist, I want a very large implant, and a doctor may refuse, and then they find another doctor that's willing to do it, and then there could be some consequence of stretching of skin, and you're well aware of all the malposition issues and things like that. So a more modest size for sure. And then I think also the whole concept of explant has become definitely much more common. I'm sure in your practice as well, because of all the awareness of ALCL and texturing. And so we're having to face what to do with that, a lift, some fat augmentation, that kind of thing.
Yeah. And you tend to use smooth implants?
I tend to use smooth implants, smooth round. I did go through a textured phase for a while, and the shaped. In the beginning, the shaped, I guess I'll talk more like to the audience that the shaped implants have the potential for a more natural slope on the upper portion and more of a full slope on the lower to create a more natural look. But the shape by nature has to be textured, and that texturing can be problematic. And then there can be some rotation, other issues. So I found some issues with the textured, and the truth is that I think a smooth round implant in a proper pocket placed properly can give a very natural look. It doesn't have to have a fake look. So as you know.
And what incision are you tending to use, David?
I tend to use an inframammary and tend to go under the muscle. I do use the Keller funnel. And I have to say that in the last 5 or 6 years, I've been very impressed that the contracture rate is lower. And I think it has a lot to do with less contamination from the breast tissue, less contamination from the skin. I use the triple antibiotic mixture, the Bill Adams formula for antibiotics. And so I mean, contracture is when the scar tissue forms around the implant gets very hard, as you know, and for people that don't know, and then it's just it can be real problematic because there can be a high recurrence rate once it forms.
Yeah. So with all those things, with the triple antibiotics, that's good. So what do you do? So how did you build your practice up? So you're originally from northern.
Yes, I'm from New York and Massachusetts. I did my training at college and medical school up there, and then I met my wife in college in Massachusetts, and she lives here. Her family was from Florida. My family from Massachusetts. So we kind of weighed the possibilities and said, Massachusetts or Florida? I really enjoy the weather here. Not maybe in the middle of the summer. So we decided to come and set up a practice 30 years ago where my wife's family lives. So we're pretty close by, which is nice.
Yeah. And where is that? You were describing it. It's just south of Fort Lauderdale.
Yeah. Well, Florida is a very long state. In fact, we were talking to some friends last night. They were talking about, with flights being not as common now, people driving. So if they have family up in, New York or something to drive, literally 1/3 of the drive is through Florida, because Florida is about 600 or 700 miles long, and we're in the far south part of the state. So if you drive up, it takes a long time. But we're in the southernmost part. There are 3 counties. There's Miami, Broward, and Palm Beach, and it's like almost a different country or a different state than the upper northern part. We're about an hour north of Miami and about 15 minutes outside of Fort Lauderdale, which is it's like we're an outer suburb of Fort Lauderdale, which is a smaller city than Miami, about 45 minutes north of Miami. Yeah.
Well, it sounds like a lovely place to live. And how do you cope with the constant sunshine?
I try to wear sunblock, especially when patients say, I tell patients to wear sunblock all the time. Yeah, I mean, you try to go out early in the day for a jog or in the evening. Definitely avoid the middle of the day. I mean, when I'm driving and I see, construction workers are working outside, I just can't believe, I mean, how much exposure they have.
Yeah.
And then, yeah, the winter, we do have a few good months, usually from about November, December through to about February. It's really nice. That's the peak tourist season when people like to come. People
Yeah.
from the UK and Europe, and then Canadians, and people from up in the north part of the United States.
Yeah, come and chase the sun. Yeah. So
Absolutely.
what are your plans from now, David? You run a very successful practice. What are you going to be doing in the next 5 years or so?
I actually, we actually just signed a 5-year lease
Uh-huh.
because I had a 10-year lease, and then I said I'm getting ready that I'd like to slow down at some point. So we signed a 5-year lease, and we're kind of committed for that. And I'm hopeful that at that point maybe I can stop working. We'll see how it goes. I mean, this is a very scary time, of course, with this pandemic. But fortunately, we had several patients that were ready to be done. In fact, the patient I did yesterday, she was very eager. We had a handful of patients that we've been contacting, staying in touch. And I would say that, only one said, look, I really can't do it financially. Another one said, I'm kind of nervous to get back. But this patient was very anxious and eager, and we did it in the hospital and very safely. But fortunately, we're, going to try to ramp up, and I think we'll have some more surgeries to do, and try to get back operationally, but as carefully as possible. We're going to do all the distancing, the
Yeah.
mask, and
Yeah.
everything in the office.
Yeah. And what meetings do you tend to go? Do you go to meetings outside the United States, or do you?
I go to I try to go to a national meeting, the ASAPS, the Aesthetic Society, and I haven't been to an ASPS meeting, but I've certainly been. And then there are local society meetings. There are plenty of there've been plenty, of course, virtual meetings. I attended a couple already. The Aesthetic Society had one a couple weekends ago, which was
Yeah.
nice. Yeah.
Yeah. That seems to be the way things are moving a little bit. Do you think
Yeah.
what's happening now is going to change your practice, David?
Well, I really do think a lot of the smart guys that have been leading the way here have been talking about the virtual consults, which I've been doing a few of, and I think it might be a good thing to do to implement
Yeah.
because the whole concept of we do free consultations for cosmetic, and
Yeah.
so sometimes you spend a long time with someone in the office and you really don't get anywhere. They don't seem like they have reasonable expectations. We try to screen them on the phone, of course. So if you can screen them here, then you can get a good idea that this is someone that you're probably going to want to operate on. They have good expectations, are good candidate, and you don't waste a lot of time in the office, and you're not getting as much exposure. The whole concept of exposing, with the virus and the transmissibility, we're going to try to keep our volume down in the office, and this is I think it's a good tool to continue to use. I've heard
Yeah.
from a lot of the people you've been talking to are, thinking about doing the same thing.
Yeah, I think a lot of people are thinking, I think maybe it's just accelerated, David, where we were going
Yes.
anyway.
Yes. Yes.
So
Absolutely.
maybe if you look on the bright side, that might be a good thing.
Exactly.
Yeah. So, and then this afternoon, what does a surgeon do on Saturday in Florida?
Well, some of us continue to work, but I don't. I try to take the weekend off. And so,
Yeah.
in fact, this afternoon we're planning on playing golf. My wife and I try to play together. I play with the guys sometimes, and then my wife is quite competitive. She enjoys playing, so we play together. And today we're planning on going, and the club has just reopened.
Yeah.
It was kind of crazy that it's a private club, so you know how people can be kind of crazy, and they're like, with the holding up the arms and the rakes, we have to get back there. It's a sport where you can distance. What's the big deal? We'll stay apart. Plus, we own the club. So the county was restricting it, and now it's open. But there are restrictions. You have to be, if you're in the same cart, you have to be related. Otherwise,
Yeah.
there's no contact, no high fives, and leaving the pole in, like we were talking about, leaving the flag stick in because you don't want to touch it and contaminate it. So it's
Yeah.
it's a little bit different, but we'll be able to get outside and get some fresh
And who
air.
normally wins out of you and your wife?
Where it's pretty close, actually. I always tell her that she plays from the ladies' tee, so it's not fair. But she's good. She's very competitive, and she's good. She has a clinic that she does, and she plays with some girlfriends, and then we play together on the weekend.
Yeah. Is she more competitive than you, David?
In general, I would say so. Yes, yes.
Well, that's good. So,
Yeah.
so yeah, she keeps you going.
Yes, exactly, exactly. How
Brilliant.
about you? Do you play a sport?
I play quite a lot. I run quite a lot. I play quite a lot of squash.
Oh, squash.
Um,
Okay, good. That's good.
so it's
Yeah.
a sort of squash was popular in England.
Yes.
So I play that, and I'm a bit of tennis and a bit of golf. Not very well.
Okay.
Um,
Good.
so yeah, so yeah, so I do like it. So yeah, well, I think it helps you. I think if you're in a high pressure job like us, I think sport does help, doesn't it? To
It
you know,
reminds me to breathe, because I think that breathing is something you don't think about, and
it's
then
true.
sometimes like you find yourself in an operation and you just I had one of my professors that I remember from a long time ago from my residency. He was an excellent microsurgeon, hand surgeon, and you would have someone that came in with like a mangled hand or something,
Yeah,
and the nurses are all looking at you like, okay, you're going to put everything together, everything's going to be great, and you're thinking like, how the heck am I going to do this?
yeah,
So you have to take some deep breaths, take your time, lots of irrigation. So it's the same thing when you get up to hit a ball. If you're holding your breath, you have to breathe, you have to relax, and same
yeah.
thing in surgery, any type of stressful moment. So it's it's definitely a good thing to do.
Yeah, you could do that when your wife outdrives you on the.
Exactly. Exactly.
You might need to do a bit
Exactly.
of breathing.
Exactly. Exactly.
But lovely to join you. Really lovely to meet you. And
Yes.
if you,
Yes.
I hope to meet you in person soon because
Absolutely. Absolutely.
it's
It's
been a
great
great
talking to you,
experience.
Adrian.
Good luck in that golf.
Okay. Okay. And have a great day. Thank you so much. Be well.
See you soon. Bye
Bye-bye.
bye, David.
Take care.
Bye.
Okay. Bye-bye.